New experimental drugs continue to push the envelope in treating tough cancers. OptiTROP Breast05 is a trial that highlights the next generation drug for triple-negative breast cancer, or TNBC. The drug tested is called Sacituzumab tirumotecan and is a close cousin of Sacituzumab govitecan, or Trodelvy. Both are antibody-drug conjugates that target TROP2, a protein commonly found on breast cancer cells. Trodelvy is already approved in later-line treatment of TNBC and has improved outcomes for patients. Sacituzumab tirumotecan is a modified version with a different chemo payload. OptiTROP Breast05 aimed to use this new ADC earlier in the disease, specifically as the first treatment in advanced TNBC. This was a phase 2 study for patients with unresectable, locally advanced or metastatic TNBC who had not received prior chemotherapy for advanced breast cancer. Instead of the standard approach of starting with traditional chemotherapy and possibly immunotherapy if PD-L1 positive, patients in this trial received Sacituzumab Timoterotecan as their initial treatment. The idea was to see how effective and safe this agent is when used right off the bat. Key measures included how many patients' tumors shrank, response rate, how long the disease was controlled, or progression-free survival, and what side effects occurred. An earlier trial of the same drug in a later treatment setting, the trial was OptiTROP Breast01, showed that it could significantly improve outcomes compared to standard chemotherapy. By moving it to first-line setting in OptiTROP Breast05, researchers hope to see even better results since the patient's cancers would be less heavily pretreated. Sacituzumab tirumotecan works on the same principle as Trodelvy. It combines an antibody and a chemotherapy in one targeted package. The antibody portion seeks out the TROP2 protein on cancer cells, and upon binding, the drug complex is absorbed into the cell. There, it releases the chemotherapy payload, the timoterotecan part, directly inside the cancer cells. This causes DNA damage and cellular stress, leading to cancer cell death. Because the chemo is delivered specifically to TROP2 expressing cells, the impact on normal cells is reduced, though not completely eliminated. This means patients may still experience side effects like lowered blood counts, but usually less severe than with standard chemotherapy. Essentially, it's a way of getting more drug to the tumor and less to healthy tissue. In TNBC, which lacks other targets, TROP2 has proven to be an effective Achilles heel to attack. The initial results from OptiTROP Breast05 are very promising. A significant number of patients responded to the treatment. Their tumors shrank substantially on scans. Some patients even experienced complete responses, not visible tumor on imaging, which is remarkable in metastatic TNBC. The length of time before the cancer started growing again, or progression-free survival in this trial, was longer than what is typically seen with first-line standard chemotherapy. Although exact numbers would require referencing the data, the trend clearly favored the ADC approach. Importantly, those benefits are observed across patients regardless of PD-L1 status, suggesting the drug can help even those who might not qualify for immunotherapy. In terms of safety, the side effects seen were consistent with what we expect from this class of medications. Common ones included neutropenia, which are low blood cells, fatigue, alopecia, which is hair loss, and some gastrointestinal upset. There were no unexpected severe toxicities, which means the safety profile is predictable and manageable. Patients did need supportive care for low blood counts, like growth factors or dose adjustments in some cases, but overall the treatment was delivered safely. Clinical implications of this trial: if these findings are confirmed in larger trials, Sacituzumab tirumotecan could become a new first-line option for TNBC. For patients, this would mean a chance at better outcomes right from the start of treatment. Instead of starting with older chemotherapies, they could receive a targeted strike against the cancer, potentially controlling the disease longer and with a different side effect mix. It could be especially beneficial for patients who are not eligible for immunotherapy or PD-L1 negative, giving them a powerful alternative. For doctors, this trial adds to the excitement around ADCs in breast cancer. It suggests that even in the toughest subtypes like TNBC, using an advanced drug early can shift the trajectory of the disease. Eventually, we might see a paradigm where newly diagnosed metastatic TNBC patients receive an ADC like this one, plus perhaps an immunotherapy rather than the classic chemo combos. It's part of a broader trend, taking the most effective new drugs and moving them up to frontline use to maximize benefit. In summary, OptiTROP Breast-05 offers a glimpse of a future where targeted therapies play a starring role from day one, aiming to improve survival and quality of life for patients with triple-negative breast cancer. Thank you for listening.